Good afternoon. You are joining us live for this month's episode of Science Stream, which is in conjunction with Mosti's Minggu Science Negara. Welcome. We'll be starting our broadcast in a bit. Meanwhile, please make yourself comfortable. If you have any questions for our guests, you are welcome to leave them in the comments or chat section, depending on if you are joining us via Facebook or YouTube. See you shortly. Hello once again, especially to those who have just joined us. I'm Sean from Penang, Penang's very own Science Discovery Center. While the National COVID-19 Immunisation Programme, NCIP, has started in earnest with the arrival of the first batch of vaccines at the end of February 2021, the percentage of eligible people who have registered for the vaccine remains low at 32% up till April 2nd. This could be due to public concerns, such as the scepticism of the new vaccines, the faster than usual speed of development and approval of the vaccines, the efficacy of the vaccines, especially with the emergence of newer strains of COVID-19, the reported side effects, and many others. Dr. Kevin Ng Wei Shan, an anaesthesiologist from University of Malaya Medical Center, will join us again after 1 year to share with us about his own experience with the COVID-19 vaccination, as well as enlightening us on the vaccination in general in this episode of Science Stream, which is in conjunction with Mosti's Minggu Science Negara. Dr. Kevin graduated as an anesthesiologist with a Master of Anesthesiology from the University of Malaya in 2015. He won the K. Maharaja Memorial Gold Medal as the overall best anesthesiology candidate for his year. His love affair with anesthesiology began way back in 2008, where he was inspired to join the field after meeting the many inspiring anesthesiologists who were able to tie the wonders of physiology to clinical practice. Since graduation, he has served in Hospital Kuala Lumpur and Hospital Sultan Haji Ahmad Shah Temerloh before returning to University of Malaya, where he is currently employed as a medical lecturer and anesthesiologist. His interests include pediatric anesthesia, regional anesthesia in pediatrics, and patient blood management. Without further ado, let's bring on Dr. Kevin to the show.
Hi everyone, and as usual, when I wanted my
It's okay. Welcome to the film, Dr. Kevin. Thank you for agreeing to be with us again today. So sometimes you'll be able to see Dr. Kevin's face, like now, and then it disappears again at times. Okay, he's having some issues with his camera. But I think what we want from him most is what he has to say. So we'll proceed on. So Dr. Kevin, how is the third wave, which started in September of last year till now, different from the second wave when you were with us on this program last?
Yeah, hi Sean. Yeah, it's good good to have. It's good that you all have brought me back here again. When I first talked to you all last year was right at the start of the first wave, and we have just started our COVID, receiving the COVID patients. The second and third waves were definitely much harder on us. There were more patients. We've expanded our ICU to a peak of 15 patients at one stage. Sungai Buloh went up to 45. You know that there were a lot more ill patients, especially coming into ICU. What we did see in the second and third phase definitely was more category 4, category 5 patients. That means the sicker patients, those with worse pneumonias coming in, especially in the elderly age group. So it definitely, well, given that the number of patients also increased, I guess the number of patients that we saw in the ICU and in the wards definitely increased as well lah. And on top of that, I do have to say that during the initial MCO, everybody was excited to have 2 weeks holiday, things like that. But by the time the second and third wave, everybody, the economic toll, the social toll was coming down on all of us. Everybody was feeling very tired. Everyone was very restless, very agitated. And then the unfortunate events that led us to the second and the third waves, where we had so many patients. Every day we see record numbers. So it was definitely a more challenging time.
Yeah. Everyone wanted to get out. They don't want to be in their homes.
Yeah.
It felt like a cell to them, a prison cell. So, okay, before we proceed further, Dr. Kevin, I'm sure you would also like to know the views from our live audience. We'll be conducting some polls, and the first poll that we have on Facebook today will be: have you registered for the National COVID-19 Immunisation Programme, NCIP? So, have you registered for the vaccine? Okay, so the options are A, yes; B, no, but I am going to; C, no, I do not plan to. Okay, so choose your answers below. All right, so those joining us on Facebook will be able to participate in this poll. If you're on YouTube and you want to participate, you can head over to our Facebook page, Tecton Penang, and you will be able to participate in the poll as well. Right, so let us know what you think right below. Just below there, you'll be able to click on the answers. And don't worry, no one else can see what you have answered, not even us, right? Okay, so what are vaccines and how do they work? What are diseases that were successfully controlled by vaccines prior to the start of COVID?
Okay, I'm giving up on the camera lah. I'm sorry, Sean.
Yeah, no worries, no worries.
Okay, so vaccines essentially are like training. Every time you want to go for a major exam, you always sit for a trial test first, right? We always sit for a trial exam first. So vaccines effectively are trial exams for the immune system of our body. It's a training. It exposes the human body and our immune system to a little part of the virus that we are targeting. Okay, and with that exposure, the body then learns to build a response. And that's what we say, it is an immunity. It builds an immunity towards that particular virus. So that immunity is usually in the form of what we call memory. It's a memory immunity where we build up antibodies against that particular virus. We have this so-called B cells in our body that become memory cells that recognize this virus. Okay, this is what we have. This is who you are. And if you turn up, this is what I'm going to produce to get rid of you as an unwelcome guest in our body. So there are a lot of vaccines nowadays. You can see we are further expanding our national vaccination program to even include against pneumococcal, which is the streptococcal pneumonia vaccines, against pneumonia, well, the most common cause of pneumonia in children. So what we're looking at is various types of viruses, especially have a lot of vaccines that have been formed. The hepatitis B is probably the one that is very well known. TB vaccines helped us overcome not TB pneumonia but TB meningitis in children especially. Then we had mumps, measles, rubella, whooping cough, all these things, all we had the vaccine that have dropped the rates tremendously. And even, well, the one that we've eradicated at this point in time for smallpox, one of the first vaccines that came out, where the smallpox vaccine actually managed to eradicate smallpox from the world.
Okay, do we have the results? Let's look at the poll results. Do you have them yet? If not, then we can continue.
Yep.
All right, let's look at the poll results. Okay, well, at least no one chose C, that they do not plan to register. So half of our audience has registered, another half planning to. Okay, so we will get, since we know that all our audience do intend to get registered if they're not. So let's have our next poll. Okay, so let's see which channel our audience registered for the vaccine with our next poll. Okay, and if, let's just say, you also intend to register, how would you intend to register? Okay, so how did you register, or do you intend to register for the COVID-19 vaccination? A, MySejahtera app. B, through the online form at the vaccinecovid.gov.my page, or through the hotline, okay, by calling the toll-free number, or through outreach programs, at kiosks, at the wet markets, etc. Right. So, Dr. Kevin, how was the COVID-19 vaccine able to be developed so quickly compared to other infectious diseases? Okay.
I would say it's because COVID affected the entire world so fast, so hard, and shut down the world, that everybody came together to quickly cooperate to create the vaccine. It's also partially economics. Vaccine to to create a vaccine takes a lot of funding and a lot of investment by the various companies, and in this by the government as well, right? So we in the past, when it comes to a particular infection, in particular virus, it's usually the companies themselves that's investing the funding in order for the vaccine to be developed for individual viruses. But with COVID-19, there was a global push for the vaccine development. So that's why you see it was so fast, because the amount of money being poured in, amount of help, amount of assistance given for ethical clearance, for sharing of knowledge, everything opened up. The whole world came together to cooperate to come up with this vaccine. It's not that the vaccines were came out and it's not compromised. It's essentially using existing technology, but working very hard together to come up with it. I think one thing we can see from this, from the COVID-19 vaccine program, essentially, or the formation of the vaccine, is that if the world actually comes together, works together, we can actually do very amazing things. It's just most of the time, everybody will keep their own data to themselves, and not share. The first step, of course, the big step was the mapping of the genome of the coronavirus. Once that was out, then the various techniques came about. Experience from the Ebola virus vaccine program also helped, as well as the other vaccines that we have at this point in time. But I would say that the main drive, of course, is definitely the cooperation, that the whole world came together just to work on to create the vaccine so that we can go back to life as we want it to be.
Okay, let's see how our audience registered for the vaccine. Okay, we have the poll results for that. Okay, everyone wants to use the MySejahtera. Yeah.
Okay.
I, so I've been helping some elderly in the community to register. Gotten a few hundreds registered. Most of them don't have the MySejahtera app, or their phones can't use the MySejahtera app. So we have to use the online registration form. Some do not have handphones. They still have landlines at home. So I guess that's why you have all the other channels. But I think there's going to be a challenge. As we can see in the MySejahtera app, we can check our status very easily. But if we register online, we do not know. We are in the dark. If we register to the hotline, we also are in the dark. We are waiting for the call to come in. And we may not be at home when the call comes in. So I can foresee that the phase 2, which involves the elderly, there will be some complications. Okay, all right. Since now we have 2 vaccines already arrived, so what are the differences between the COVID-19 vaccines which Malaysia has procured so far?
Okay, so at the moment we've got 2 that are being used. Pfizer was the one that first came in. Pfizer is a mRNA vaccine, right? It's never, I would say, it never been used before as vaccine technology. It's first being used now in the coronavirus vaccine. So there was a lot of worry about what it will do to you and all that. Essentially, mRNA is a very simple thing. It's a message that has been essentially a message that's been downloaded in a way from the coronavirus, and it's been carried by a nanoparticle into our cells, and then it will then teach our cells to exhibit that a particular protein called a spike protein that will then be presented to our immune system, and then our immune system will learn how to fight coronavirus from it. Whereas the Sinovac is inactivated virus. Effectively, they have taken the coronavirus, killed it or inactivated it, and then inject that inactivated vaccine into your body, and your body inactivated virus, sorry, into your body, and that will then cause then that will activate our immune system to build our antibodies and immunity to it. So as you can see on the slides, the mRNA essentially is just delivering a message from the virus. Instead of giving us the whole virus, we just get that message on the mRNA, and it will then, after that, the process will then cause the production of that spike protein on the cell itself, on our body itself. Okay. The Sinovac vaccine, like I said, is a killed vaccine or attenuated vaccine. Killed vaccine. It's just inactivated coronavirus injected into your body. So you should not have any. There's no chance of you actually developing coronavirus from the vaccine itself. It's just that your body will then recognize it as foreign, and then because it's already learned to fight against the inactivated form, then if should you be exposed to coronavirus, you have a better chance of fighting off the infection. So this is one thing that we see in the majority of the vaccines, right? We are not, you don't, it's almost, it's not 100% you will never get COVID-19. It's just that even if you get it, you stand a better chance of having very mild disease. And even if you look at Sinovac, even if you do contract COVID-19, it's 100% effective against preventing severe disease, and about 80-90% effective against moderate disease. So you may end up with very mild disease, which is mild symptoms, and actually it's very, very safe. So actually nothing much to worry about. Okay.
So how about the other three that have not come into Malaysia yet?
Okay, so the other way that the vaccines have been formed is to have a virus vector, which is what AstraZeneca is doing. The AstraZeneca, Sputnik, and the CanSino Bio, the other China vaccines, uses a viral vector. It's an inactivated virus capsule from the various viruses, usually the adenovirus, which is a very mild respiratory virus, and it's used to transport the genetic code of COVID-19 into your body. So instead of having a nanoparticle that covers the mRNA and carries it in, it uses a viral vector to bring in the genetic code into your body, and then the human, our cells will then use that genetic code to produce that spike protein, and then that process is still the same. The spike protein is formed, and then after that, subsequently, then the body will the body will then react, the immunity will build, the antibodies will form, and you get immunity to COVID-19.
So after your explanation, let's see out of the three categories of vaccines, which which are the ones that our audience are most confident in. All right. So A, the mRNA one, the one that prior to this is like, wow, what is this new?
Everybody
new one?
was afraid of it. Everybody was
Correct.
thinking that suddenly you start emitting 5G from your body.
Yeah. So the examples would be like the Pfizer BioNTech one and also the Moderna. Okay, and the next one, B, adenovirus vector, which is used by Oxford AstraZeneca, Sputnik V, and Johnson & Johnson. And also C, inactivated virus, which is the Sinovac one. I think I did hear that many more conservative, so they prefer the C rather than the A one because A is like too new to them, so they trust the old technology. But let's see what our audience would be most confident in, right? So how safe are the vaccines since they may not have been tested as rigorously as previous vaccines? I mean, yes, all the effort has been put in, all the money has been put in, all the sharing of information, but there are times that we take years to do the trials. So now it has been accelerated. So we do not know how is it going to be like in the long term. As I understand, maybe we have 6 months or a year's data. So how do scientists study the safety and efficacy of a vaccine that, especially the COVID one, that it becomes safe to us and is long lasting?
So when it comes to vaccine development, or in fact any drug development, we've got a few phases to the process, right? Initially, we develop the vaccine, is tested, lab tested, then animal testing, and then after that, then controlled humans, and then finally phase 3 trials. So phase 1, phase 2 is usually lab and animals, and phase 3 will be human beings, right? And then phase 4 is post, after you have already released it, and then that's what we are doing now, the follow-up trials, the follow-up, whether is there any adverse events and all that occurs. So what was accelerated is the approval to conduct the trials. Okay, a lot of times with our previous drugs and all that, or we will take more time. We would like to see even the phase 3, after phase 3, before it's released, it will be released in limited numbers, and then we reassess again before it goes all the way out, before it's released worldwide. But now we are accelerating to get faster production, to get an improved, I would say, roll out at an earlier stage. So whether is it safe or not, what we know is this, right? It's gone through very vigorous phase 3 trials. Most of the drugs. most of the vaccines that have been brought in have already undergone very vigorous phase 3 trials. You can see that the safety profile, especially the two that's been most reported, the Moderna and the Pfizer vaccines, actually have a very good safety profile, have very good efficacy. That means it's really very effective. It does what it's supposed to do. The Sinovac vaccine, a lot of the data was not shared, or rather not readily available, as Pfizer and Moderna, because they are more published and there were more sharing of data from it. Sinovac, the major trials outside of China shared their data. Okay, the Chinese data is still pending. They've released it, but it's not been peer reviewed. So that's one thing that a lot of us were wanting to see it before we could comment further. This is the same with even the Russian data also is about there. There are some reports, there are smaller trials, but the large trials have been Pfizer, Moderna, and the AstraZeneca vaccines. J&J is the new vaccine that's just recently been approved as well. J&J, the good part about it is a single dose rather than double dose, so you don't get poked twice, just once only. So in terms of safety-wise, here's what we have. Normally, when we create a vaccine, we will study the long-term effects as well, right? You will release it in a limited time, then you will study the same group and look at it 1 year, 2 years, and we will have a long-standing safety data. What we have for this is their follow-up has only been at the most at this time, the published data is about 6 months follow-up. So we know what happens to the majority of us after the vaccine up to 6 months. Okay. Further than that, the data is coming in. So new things will come in, will be updated and all the informed to the public via journals, and then from there the infographics will come out, and then the discussions will come out. But at this point in time, the safety data is really very good. Okay. US, UK, even Malaysia, we are actively collecting the adverse events. Okay, sometimes to the point of over-reporting, where there's the joke going around where a man gets a COVID vaccine today, tomorrow he passes away because he got hit by a car, right? So we say COVID-19 vaccine causes car accidents. So that type of thing is coming out, and there's a lot of adverse events that may or may not be really related to the vaccine itself. When we talk about a vaccine safety, that vaccine is exactly the cause of a lot of complications? No, there is hardly any reports. It is really, we are now at almost 500 million doses given out worldwide, right? And if you look at the benefit of it, the number of cases in the US and the UK has dropped drastically, from tens of thousands of cases a day. They are now dropped to, under, I think the UK one was under 1,000 or something. No, sorry, that's us. So under 10,000 from the UK. So it's dropping to a few thousand a day. From tens of thousands a day, hundreds of thousands a day, is dropping. And this shows that the faster you vaccinate people, the better you can get this disease under control. Definitely, the longer you wait, the more variants are going to form, right? Now, this is the nature of viruses, especially respiratory viruses. They mutate very, very fast. Okay, it's essentially a matter of the viruses want to survive. If they don't mutate, they will die off. So that's why they mutate to keep on their own survival. So if you see the flu vaccine, at one stage everyone was worried about H1N1, H5N1, okay, and all these other viruses, and now it's become a seasonal flu per se. And every season, in the US, in the UK, most of the cold weather countries, every flu season, all the seniors, everybody is encouraged to get the flu vaccine, and the vaccine will then be formulated for what they expect this year's virus to be. So which virus is coming to the party, that is the vaccine that will be produced. So if you read some of the reports and all, safety wise, I know I would say, and I would reiterate, it is safe. there is no compromise in terms of, let's say, closing 2 eyes, 3 eyes, and then rolling out the vaccine without proper data, without proper clinical trials. No. Everything was followed, except everything was expedited. For example, if you were to get ethical approval for a certain trial, sometimes it can take months to years. But because of COVID-19, they've pushed it, they've rushed it, they've looked through, and they have approved it in a speedier manner. Sometimes a month or 2 months like that, you get ethical approval for you to proceed. Okay, these are things that there's a lot of administrative hurdles when you do a trial, and these were all expedited. So you've got funding, you've got expedited admin. So we just have to ensure that the trial was carried out well. And from the data that was shown, it was done, it's followed all the procedures that we normally do, and the safety profiles were there.
All right, so let's have a look at the poll results.
Yep. Just now was about 1/3. Everybody was okay with all.
1/3 is the inactivated
Now it's
virus. 2/3 prefer the mRNA. So
then nobody wants the AstraZeneca anymore.
yeah. So okay, let's see what is their biggest concern about COVID-19 vaccine, if they have any. So A, I do not have any concerns. Okay, so no concerns. You choose A. B, I do not trust the vaccine. So yeah, you totally the other end of the spectrum. C, I'm afraid of the side effects. And D, I'm afraid of taking injections. So yeah, I've heard of a few, like a very small minority, they are afraid of injections. So like what you mentioned, needle phobia, or sometimes blood. Okay, Dr. Kevin, you mentioned about AstraZeneca. So AstraZeneca's vaccine is receiving a lot of bad press now, with certain countries halting its use due to the incidences of blood clots, some resulting in deaths. Can you tell us what you know regarding this developing situation?
This one is like I mentioned earlier on. There's a lot of fear going around, especially when you're introducing something new, right? And every time you have something new that's introduced into treatment, into healthcare, every little complication that comes about, you will be extra worried, wary. But if you look at it this way, like I said, you've got AstraZeneca, the rollout, I think almost 1 million plus vaccinated. The number of people that are actually getting the complications are very, very small. It's not, it could also be due to chance, right? It could be that these people already are predisposed or had a higher risk for these thrombotic events, and that's why they developed the thrombosis. The data at this current moment, everyone is scrutinizing because they want to be very careful. They want to be safe. I would say we were really looking at it from a real safety point of view. And when you look at it that way, okay, the majority of patients that have received it are still fairly, that there not been major complications. It's not been often enough that you would say that, yes, this is due to COVID-19. But because you want to be extra careful, what you do is, okay, we stop first, let's relook the data. It's the same thing that happened when the vaccine was rolled out in Seoul, South Korea, where we had that 40 deaths after they vaccinated all the elderly age group in Korea itself, and then they halted the vaccine itself. But this was not the COVID-19 vaccine. This was the seasonal flu vaccine. So it's the same thing, that when something happens after being given a vaccine and we can see a trend, we halt, we reassess before we continue. Okay, it's a normal thing that everyone will do. It's an extra precaution. From the data that we have, the majority of the world still agree. So the majority of drug authorities still agree that AstraZeneca safety profile is still okay. We do not have enough evidence to say that AstraZeneca is the cause of the blood clots. but we do see that there is a increased number of people that develop these blood clots. Whether were they predisposed or not, this is being investigated at this moment. So until all this data is found, you can't really say or blame the virus immediately. Okay, the vaccine immediately. Okay, um, I would still be cautious, but I would look out for more data at this point in time to actually say no, AstraZeneca is no good. No, I can't. Right, but the majority of countries are being very careful, very wary about it. What our country, what Malaysia has done, what our MPRA has actually done is they are also reviewing the data carefully. If there's anything that suggests a strong paper that suggests good evidence to say that it is harmful, then it will be stopped. But at this point in time, the evidence, even WHO also still reiterates that it is safe. So we will go with that at this moment.
And due to these headlines, it's actually causing a lot of people
Yeah.
some hesitation in registering because they do not want, when they have registered, and because we do not have the option to choose which vaccine to take,
Yep.
that we may end up with AstraZeneca. So that's what I have heard, that there's hesitation to register for the vaccination is due to one of the reasons due to this. All right, let's see what's our audience biggest concern regarding the COVID-19 vaccine. 50% I do not have any concern, and 50% side effects. Okay, so since we're talking about side effects, maybe we can talk about the side effects now. You have taken both doses.
Yep.
Can you share with us your own personal experience and also tell us what are the known side effects?
Okay, so the vaccines itself, what I felt after the first and second dose. The first dose was horrible. Um, but that being said, even when I get the seasonal flu vaccine itself, also I also feel horrible. It's fairly common. It's what what we have is quite normal. Okay, my camera has decided to give up again. First thing that you have, of course, is pain at the injection site. In my case, was the left hand, right? Pain in the injection site is very common. I would say 80-90% of us will have some pain at the injection site. It usually relieves itself by about 2 or 3 days. Second day normally is the most painful. First day is a little bit. Second day you get a very numb, not numb, very sore left arm. Okay, I had a little bit of lethargy and tiredness after the first dose. And of course, you were more hungry than normal. You'll be surprised that a majority of people actually say that they are they are more, the appetite increases. You feel really hungry. Um, about 30 to 40% of people will have some headaches and some fever. About a quarter of us had fever. Now, if you read the reports and all, the second dose was supposed to be worse. But for me, surprisingly, the second dose was fantastic. After the second dose, I only had a bit of discomfort at the left arm. Other than that, I felt fine. I did not have any tiredness, no fever. I was on call on the day that I received my vaccine. No issues with that as well. Felt good. Some of my colleagues and all after the second jab definitely developed fever, that malaise, that tiredness. But other than that, no, nothing really major. There is definitely a risk of anaphylaxis, as in giving you anything, this new medication. Every time you take a new medication, of course, there is a risk for you to develop an allergic reaction, what we call an anaphylactic reaction. I think it's fairly rare. It's reported as about 1 or 2 cases every 1,000 jabs. And most of the time, it will be relieved by the delivery of what we call EpiPen or IM adrenaline to treat it, or supportive therapy, and then it will relieve. What is good about the vaccination program and all, it's been planned so that you are observed 30 minutes after your jab. So after you have been injected, you will be seated in a very nice and comfy chair in my center anyway, and you will then be observed for about 20 minutes, 30 minutes. If you're feeling uncomfortable, we just have to inform. There was an emergency team on standby, ready to treat you, to help you through that. Like I said, most of us felt good, felt fine, and now that so hopefully in another 1 week, I'll be 2 weeks post vaccination. So then I'm 95% protected. So then if we get passport untuk kembali ke Penang, that will be a good thing. My parents have not seen me in over a year. But yeah, that's it.
Yeah. My mom also has gotten both doses. The first dose was okay. I've heard most, even those who have taken both doses, most were okay for the first dose. The second dose, that's where they have the lethargy, the chills at night, feverish but not reaching the fever. My mom had the swelling of the lymph nodes, but apart from that, it was all fine, all fine. So yeah, everyone has varying effects, but I mean it's a good thing. It shows that actually your body, your immune system is getting to work.
Yeah, that's what they would say, that if you have your what is that? If you have a reaction, it means that your immune system is actually working. That is true in a way, but on top of that, you don't want it to work too hard as well.
Yeah. Okay, so why do some vaccines require two shots? Some, like what you say, Johnson Johnson, one shot. So a lot will like say, yeah, I want one shot. Maybe for those who are afraid of needles, so one shot. Why do we have this
So
variance?
it depends on how what was given to the body to work with. It's if you're going to give too high, if your body reacts well to it, right, and the immunity built is enough after one shot, then you will only need one shot lah. Essentially, is that lah. Okay, but if you've given the vaccine and you not yet completed your so-called immunity. So after the first Pfizer vaccine, you will get about 60% protection. It means that out of if you're exposed 10 times, 6 times the body will react in the appropriate manner, 4 times it will get past because it's not yet built the immunity, not yet built the wall. The body is not trained enough. So it depends on which and how the delivery is, and from there it will then the studies will be then studied, and then we will show how well our immune system has reacted and how well the protection is. So if you say 2 doses are enough, actually some places are already considering going for a third dose already. We are actually looking whether do we need a third dose in another 6 months time or in another year's time, and we will only know this in the near future. At this point in time, it depends on on the way the virus has been inactivated. What is the delivery of that vaccine that will determine how many doses that you will have to get.
So the booster shot, if let's say we need to have to get it next year.
Yeah, there is a chance that we may end up with a third dose.
Yeah, it's not because we have a new variant. It's also because the immunity has
It
dropped.
could, yeah. So at this again, like I said, we've have data up to about 6 months to a year from the first people vaccinated with Pfizer. Pfizer, I think, was May June to September last year, 2020, that they started their first trial. So we are getting the 6-month data at this point in time, and whether do you need a further boost or not to give you that further immunity, sustained immunity, is still being discussed. At this point in time, a bit difficult to say lah. I would say with the new variants coming out, we probably will need a third dose. That's my feeling for it. Okay. Two reasons why I'm saying this. Number one, when the Pfizer and the most of the vaccines that have been tested at this current moment came out, the variants were not out in, it were not fully established in the community at that point in time. So because of that, you get a higher efficacy rate, and you don't know whether these new variants exhibit the same spike proteins or not. That's one of the concerns that we have. But at this point in time, the new studies that they have been showing, the spike proteins have actually shows that some cross coverage by the current vaccines that we have. So we should be safe, but at a lesser rate than expected. Now the the J&J one has been tested against the new variants, because J&J is now just completed its phase 3 clinical trials. That's why they've just been approved, and it was tested for the South Africa variant and the UK variant, and it did show still relatively good efficacy rates, about 70-80% to those variants. And the good part, of course, is that it reduces the severe disease. So I think that's what we are looking for.
Yeah, I think a lot of people do not understand that the reason why we're taking this vaccine now is we can still get infected. It's just that
Yep.
We will not reach to the critical stage. We
Yes.
will survive through this. So a lot of people think that, if I can still get it, why should I take the vaccine? But they
Yep.
don't understand the reason why we're taking this vaccine now is actually to not reach the critical stage, to be able to survive through this.
I think this is the same question, or the same thing that's been thrown worldwide. Even the US also, the anti-vaxxers and the people that think that COVID-19 is still a hoax somehow, God knows how, but they still feel that it's a hoax. But they are of the opinion that if you take the vaccine, you still have to wear masks, you still cannot have all your gatherings and all that. So why take the vaccine? And if you ask me, my answer is very simple. The reason you still wear a mask, the reason why you still cannot have large gatherings, the reason why you cannot be, going back to normal, is because not enough of us are vaccinated. It's as simple as that. If everybody is vaccinated and you got 100% vaccination, right, or even 90% vaccination, then you can ease all these restrictions, because your risk of infection drops very low, because there are hardly any infective people out in the community, because everybody has been vaccinated. And because you have been vaccinated, your risk of contracting the disease when you have been exposed drops as well. So because you got these two protective mechanism, then it would mean that we can ease our restrictions on the current social restrictions that we are facing. So unless we can get everybody vaccinated, then we can start leaving the mask off and on. So if you see the CDC, they've just come out with their recommendations that if you have been vaccinated, what are the benefits? You don't have to wear a mask in enclosed areas with another vaccinated person. So that's the benefit that's there. As long as we can get everybody vaccinated, then you don't no longer need your mask. But as long as there are some of us who hold out and say and be selfish and say that no, I'm not going to vaccinate, okay, then we are going to have trouble. We're going to have problems.
Okay, but there are also those who are not able to take the vaccine.
Unable, yes. And that's why those that can, we have to vaccinate to protect those that cannot. Children, the vaccine has not been tested in children. right? Vaccine has only been tested in adults. Even the adults above 65, they are only now starting, the data is coming in and all. One of the things the AstraZeneca had issues with was that a lot of their complications actually occurred in the elderly above 65 years old. And maybe AstraZeneca has that, increases that thrombotic risk in that age group. Whether is that something that is true or not, again, is being looked at. Pfizer tested from 16 to 65, so above 65, again, it's extrapolated data. So all these things all come into play. Number one, children cannot be vaccinated at this point in time. The tests are being called for. They are now only starting the phase 3 trials for this. So we will take us another 3 months, 6 months before we ever see the data and whether it is beneficial or not. One thing we can be very thankful for, we are very fortunate with, is that COVID-19 does not affect children in a very severe form at this current moment. Majority of children, thankfully, have a relatively mild disease, but they can then carry that disease as asymptomatic carriers and bring it back to their lovely ato, apa, ama, akong, ama, that type of thing, or your grandparents and all, and give you the disease. And because you are at that vulnerable age group, you will end up with severe disease if you're not vaccinated. So these are things that we all have to look at. It goes both ways. We vaccinate to protect those that cannot be vaccinated, right? And then we also vaccinate so that we can expose ourselves to the non-vaccinated and we can have, normal social interactions. That's what everybody is looking for.
All right. Let's have our last poll for today. Okay. Would you pay for the vaccine? Right? So A, yes, so I can get it sooner. So there's this issue of people saying that, oh, you're going to jump queue if, let's say, you allow this. B, yes, so I can choose which vaccine, because those people who want to avoid the AstraZeneca for the time being, or even the mRNA one. C, no, it is the government's responsibility. D, no, I cannot afford to pay for the vaccine. Okay, so choose A, B, C, D. Yes, and why? No, or why? Okay. What are your views on allowing private clinics and hospitals to provide paid vaccination for COVID-19?
I'm a bit conflicted when it comes to this point, right? Okay. We've had discussions on both sides. Now, on one hand, the private hospitals are really raring to go to help out with the vaccination program. There's a lot of push for us to roll it out so that it can be purchased by everybody, and this will speed up the vaccination program in a way, because you've got more people that are going to be administering. There is going to be more centers and all that's going to be available, so you will increase the availability of the vaccine. But then there comes to a few problems that come into play. Worldwide, the amount of vaccines are limited. Okay, even if I were to say, or even if the government were to agree that private hospitals can self-purchase and then you can start selling vaccines, private hospitals or private clinics may not be able to purchase or obtain the vaccines because the drug companies are selling directly to the government at this point in time. They're dealing with only the governments at this point in time. Even Malaysia, as much money as you have also, as much money has been put aside, we cannot purchase enough vaccines fast enough to roll out to the rest of the country. Okay, the amount of doses that we have are being given as fast as we can. Yes, we could improve on the delivery process, right? We could improve on the delivery process by engaging more with the private hospitals and the private clinics. That is being done for phase 2 and phase 3. Last night or the night before, they had their briefings with the general practitioners, where the government will provide the vaccines to the GPs, and then the GPs will administer to the patients registered to them. So it's like, instead of being crowded at the government hospitals for vaccines, you can actually get your vaccines at your local GP, but it will be funded by the government. Okay, so this is all it's two sides of the coin. Number one, we want market forces to drive, make things more efficient, to drive the vaccines progress, so that we can vaccinate more people faster. But on the other hand, like it said, that we need to ensure that it is fair, it's equitable, everybody gets a chance to get a vaccine, and we have to. It's a precious resource, and because of that, we want to vaccine who really needs it first, rather than who can pay for it first, right? So it's well, it's you really have to learn to balance with it. I would say that if the vaccines are freely available, that means that it is easily available for us all to purchase. Okay, then by all means, let us get the privates involved. Whoever can afford, pay for it, get vaccinated. But if it's going to come into the country with a limited source, right? That means we're going to have a limited amount, and it's a precious resource. Then we have to prioritize who we give it. The highest risk groups should get it first, right? Okay, those who need it most should get it first. Then we trickle down to the rest of the people. So unfortunately, then people like Sean, because you are young, fit, you will be the lowest on the list. But I think that's the way that we have to go, because the vaccine at this point in time is still a precious resource. It's a limited resource. It does not help that the rest of the world are hoarding vaccines. Like I said, if you look, some countries have actually purchased enough to go 3 times their entire population. Okay, you've got reports of the US where they are throwing away vaccines because the vaccines have to be stored at specific temperatures. So they thawed it out. It can only last for 48 hours outside of that -40 temperatures. In the normal fridge, it can only last for 2 days. They thawed it, prepared to roll out, and nobody turned up for vaccination. So they threw away, large doses and things like that. And this all, it essentially creates a lot of wastage for the world. But because they have the highest purchasing power, they've bought up so much of the vaccines. So in Malaysia, we are having something of this same problem, where we are actually getting people that are registered to come in for the vaccines, not turn up or decline. And that really messes up with the vaccination roster. And because of that, it slows down the entire process. So my advice is this: if you have been given a date to come in for vaccination, just come in and get the vaccine, right? It's not, if you delay your vaccine, it's not just that you yourself are not going to receive, it's not just yourself that's not going to receive the vaccine, but you're going to delay the process for a lot of others as well.
Okay, let's see if our audience would prefer to pay for the vaccine if it is available later this year, like what the government has been saying. 75% would pay so that they can jump the queue, and 25% so that they can choose. So yeah, 100% would rather pay if they are able to.
I think this is something that is I think this is something that everyone wants to choose which vaccine that they're going to get. I think that's the main
Draw.
the main draw that they want. Everybody has their own reservations for the various vaccines, and it's up to, they want they want some control, some personal choice to it. So at this point in time, I don't think the purchasing is going to happen until, like I said, if it's freely available, then yes, by all means, allow those that can afford, so I can, the hospitals and all can concentrate on those that cannot, cannot afford the vaccination. So then we get both sides and we get rolled out as soon as we can. But I don't think the supply is that good at this moment.
Okay. Looks like we need to wrap things up. Thank you so
Yep.
much, Dr. Kevin, for spending your time with us in the past hour. Thank you for your service.
We've got one question there, but I don't read Mandarin. Any idea, Sean? Yeah,
Okay.
I don't read
Oh,
Mandarin. Any idea?
I don't read Mandarin either. So we probably need to Google Translate. Okay, okay, let's do a quick one. Because Mosty has given us 1 hour.
1 hour,
Let's,
yeah.
yeah, so let's do a quick translation. I think they'll be happy if we just take a bit more time. Let's do a quick Google Translate on what that is. Okay.
And keep him.
Oh, how long can it last?
How long can it last? Okay, so Sharon, at this point in time, the vaccine we know can last 6 months. The antibodies up to 6 months, we are still seeing the protection. Like I said, the trials only finished in September last year, so we are only seeing the 6 months, 1 year data. I mentioned earlier on, I'm also expecting that we may need a booster in 6 months' time to a year's time. At this point in time, doesn't look like we are going to get permanent, permanent immunity. This is much alike to all the respiratory viruses that we have, that you will need a booster dose later on. 6 months, 1 year, you still may need that booster dose. So I would say available data says at least 6 months protection. Because even if you develop COVID-19, you have already caught the disease, theoretically you should be somewhat immune to the virus, but your immunity actually wears off within a month or so, right? So that's why they actually say that you can actually catch COVID-19. Even today, we've just got reports of that PSG footballer, he was positive in January, he's positive again. He's just developed COVID-19 again. So you still can catch COVID-19 again. So the immunity does not last very long. And at this point in time, from the data that's available, 6 months looks like it's still clear. How long? I would anticipate yearly we will need booster jabs until we can safely say that it's left our community.
Okay, so thank you so much, Dr. Kevin, for the past hour. We thank you for your service once again and hope you stay safe and healthy always.
Yeah, thank you for having me again. Thanks, Sean.
Thank you. That's all, folks. Let's all get vaccinated. Lindung diri, lindung semua. Thank you for being with us since 3 p.m. This episode was brought to you by Posti in conjunction with Minggu Science Negara. See you again next month for another episode of Science Stream. Have a great weekend and stay safe.